So we're talking here about babies and colic, and why, when we work using soft tissue therapy such as Bowen, we shouldn't be surprised if it produces a response in the baby which eases the tensions. So just walking through some of the facts about how your body functions at a certain level. So you have a central nervous system running down here, and that central nervous system has nerves going off to muscles and organs and glands and so on. So when we're talking muscles, we're just sort of using, there are whole system wide areas of communication, and when we do gentle work along the central nervous system, and when we do work around, for instance, the diaphragm and across rectus abdominis, for instance, so across into the abdomen, and then in here at phrenic nerve, the nerve that controls the diaphragm, you can see how we are encouraging the body to take on board where there is any dysfunction, where there is tension, where there is restriction, and we are encouraging the brain working with the body to release that tension. So if there is pipe work in here that is narrower or being compressed, it should open up a little bit, okay? And obviously in babies, everything's that little bit smaller, not normally quite as small as this, but this can be the size of baby that we might be working on. But basically, as we do that work and we are encouraging the connection, the brain and the body can help to release the tension that might be restricting the flow of movement through intestines. And then we look at whether there's anything in there physically, okay, that might be causing a blockage. And certainly in veterinary circles, it is well known that meconium, and you know that you're looking for that in the nappy and so on, at a certain point, but there is indications that sometimes there may be a little bit of residual meconium sort of left there. We also have to overlay that the fact that when breastfeeding you get the colostrum, and again in veterinary circles certainly it's recognised that acts as a laxative. And so we need these kind of processes in nature working together to encourage the system to function and to avoid the kind of cramping, restrictions, etc. And that's probably why, scientifically, Bowen so often has fantastic results with colic, and normally in one session. Okay, now we're not making a claim there, it's just science. If we release the tension and we help the body to function more effectively, it can usually sort itself out.